this next video clip, we'll look at some of the examination basics for hip external rotation. Again, when you can perform a bilateral assessment, that's always a good thing to do. So we're going to have Amanda first walk with her right hip in an externally rotated position. So turn your toe out on the right absolutely as far as you can and then walk toward me. So we want to observe how much external rotation is available in this loaded position and have a discussion with the patient as to whether or not she feels any stiffness or discomfort when she places her foot in that position and ambulates and loads through her right hip, again in an externally rotated position. Okay, I'll go back to the start position. And now let's say your left hip is the involved hip. Okay, I want you to turn your toes out on your left as far as you can. And right away you can notice that she's not able to do that quite as well. And now walk toward me. We have the patient load her left hip now in an externally rotated position. Again, ask impairment-related questions. Is the patient not able to externally rotate as well because she's painful, or because she's stiff, or she just feels she can't do it perhaps due to a muscular weakness? So let's continue the examination process of that left hip and try to determine what type of impairment is limiting left hip external rotation. So man, if you would bend your left knee, okay, and I'd like you to make this motion like this. Let's externally rotate. And for the sake of discussion, say your patient stops here. And this is as far as she's able or willing to externally rotate the hip. At this point, we can deliver a external rotation over pressure to see if that provokes discomfort in the hip joint. Then we'll bring the hip back closer to a neutral position and then repetitively apply passive range of motion in the direction of external rotation and determine whether or not we have an early end feel that's either firm or hard in nature, indicating to us capsular shortening or maybe some other type of osteoarthritic process affecting the external rotation at the left hip. Next, if you could just come up on the table for a moment. And for the sake of completeness, let's look at that left hip again, and let's test some of the muscles that produce external rotation of the hip. So if you straighten your knee just a little bit, let's have you try to make that motion. Do that for me. Good. Try to hold that position for me. Okay. Let's give a manual muscle test. Hold against me. And if these muscles were weak, we would be able to easily push the patient out of that position, indicating a weakness impairment affecting the external rotator muscles of the hip.